They figured out they had a chemical that actually did in every single mammal they put it inside of it, lowered this thing called cholesterol. Then the drug companies had to come up with a way to convince all the medical doctors to promote their drug that lowers cholesterol. Well, what's the best way to sell it to them? Tell them that the number one cause of death around the world, typically, which is heart disease, is increased in risk by increased cholesterol. And so if you just tell the medical doctors that lie, they go like this: oh, sweet. So do you have a drug for that? Good. Let me promote it. And will you give me incentives? And will you give me commissions and royalties? And yes, then all the medical doctors will tell you the same damn lie, and they'll never look into it. And the truth is, all along, I mean, how many of you have watched people doing keto diets and carnivore diets and just shredding weight? They lose weight, they're reversing diabetes, and this is them consuming protein and fat, increasing their cholesterol, increasing their fat intake. But what have we been told, especially throughout America, and I'm sure in the UK, what have we been told for 50 years? A low-fat diet is good for you. This whole thing is a lie. We have to reduce the amount of fat people consume to lower their cholesterol. And what has happened ever since? The more cholesterol drugs we sell, the lower the cholesterol levels go in this country and around the world, the higher the incidence of strokes and heart attacks become. And in every single year, those numbers have gone up. That we've actually been listening to this lie and swallowing the pills. It's ridiculous. Well, let me just tell you the narrative here. Now, we're going to use this example and put it with salt. Okay, we're being lied to about salt. We're being lied to about fats that equal cholesterol. Okay, if you tell people that they have to lower their cholesterol and we have a pill to do it and it will protect you from having heart disease, which everyone's being told this is hereditary and there's nothing you can do to avoid it but take our drugs. That's the other lie. So now you're scared to death that you can't control it because your mom or dad or aunt somewhere had heart disease at one point. You're going to have it. Your medical doctor's telling you, unless you take this drug. You start taking that drug. What you guys don't know is that the moment you start taking the statin drug itself lowers the amount of cholesterol your body can make no matter how much fat you're consuming. Right. And did you know at home, everybody, that cholesterol is the backbone required by your hormone glands in your body to make most of your hormones? I mean, you need cholesterol to make testosterone, men. Guess what happens to most men when they start taking a statin drug? They can't have an erection, and they have no sex ambition or drive. Well, where did that go? I mean, 6 months later, you're going to go to your medical doctor and tell them, look, doc, I'm glad my cholesterol numbers are better, but I just have no interest in sleeping with my wife. I can't even get it up. And guess what the MD says? Oh, that's okay. You're in your 40s. This is normal for your age. It's called erectile dysfunction. Here is a little blue pill to help you with that. When in fact, the cholesterol drug you started 6 months ago doesn't allow your body to now make testosterone because you need cholesterol to make testosterone. And testosterone drives sex drive. It also increases blood flow. So now you can have an erection. So because they lied to you initially and said fat is bad for you, causes cholesterol to go up, which will cause you to have heart disease and increase your risk of that. Take this pill. You take that pill. Now you lower your amount of cholesterol. All the side effects after that are this. Men will no longer have any sex drive, can't get an erection. Now they're going to go on Viagra, which is a drug to offset the side effects of the statin drug and the low-fat diet that you're now on. Okay, that's one. Did you know serotonin, the hormone in every male and female's body, needs cholesterol to be made?
Right.
Okay, well, what does serotonin do to humans? It makes you feel happy.
Yeah.
And it makes you feel safe. So there's no anxiety or panic. Oh, really? All right. So now you can't make serotonin. Serotonin is your happy, feel-good hormone. Now you can't make it because you don't have cholesterol to make enough of it. What are you going to report to your medical doctor within 6 months to a year after starting your statin drug?
Right.
You're going to tell them you're depressed, you're anxious, and guess what your MD's got to tell you? That's okay. This is normal. A lot of people experience this. A lot of people in my practice have this after 6 months of coming in here and getting their cholesterol checked. We put them on this drug, and now you can actually have another drug to offset the side effects of the cholesterol drug and the low-fat diet. And they can sell you more antidepressants than any other drug on the planet, and that is exactly what's happening and has been for the last 40, 50 years. So antidepressants are still the number one most prescribed drugs on the planet next to cholesterol drugs. All right, well, can't you see how that fits in? All right, so what happens when you tell the world to stop eating so much salt? Well, let me explain this to you. Your kidneys. Your kidneys take all of your blood and they filter it into urine and they excrete all whatever it is that you don't need in the body. It removes all the excess water out of your body and cleanses the body. Okay. Your kidneys have cells inside of them to convert uric acid into urine and filter out your blood so you can urinate. Your kidneys can't even filter anything in your blood without these pumps doing their job. And these pumps are called sodium, potassium pumps.
Yeah.
What is sodium?
Salt.
Salt. Okay, so these are called salt potassium pumps. Okay,
Yeah.
well, your kidneys require salt to even work. Okay, so if you deprive the kidneys of salt, guess what happens to your kidney function? Do the pumps get better or worse? What do you think?
They get worse.
They get worse and they slow down. What happens when your body starts retaining water because your kidneys no longer can filter out urine out of your body? Do you retain water or lose more water?
You retain more water.
You retain it. Will the added water in your body put pressure on your blood vessels and on your heart or reduce it?
Yeah, pressure.
It increases it. Increased water, increased pressure. If you increase pressure, what's going to happen to your blood pressure?
Yeah, increase.
It goes up. Now, you're not eating salt and your blood pressure is going up. If you tell the whole society to restrict from the time you're born how much salt you consume, all of you, because you're mammals and designed the same way and all have salt potassium pumps in your kidneys, you all over time will produce high blood pressure. And guess what you've created? A whole society of people that are going to go into their medical doctor's clinic with dizziness, headaches, fatigue, and your medical doctor's got to take your blood pressure and go, oh, your blood pressure's high. We got to actually give you a high blood pressure drug. And make sure you don't eat salt, Mary. You got to lower your salt even from where it is now. And I'm like, you guys are crazy. And this is true. The FDA in America says the maximum amount of salt every day that an American should consume is 2,300 milligrams a day in every 2,400 hours or 24 hours. What does the American Heart Association say? That's in the same country. It says we do not agree with the FDA's salt amount. They believe it should be 1,100 milligrams a day. That's less than half of what the FDA says.
Right.
Okay. How come they don't agree? That's really funny. The Tel Aviv University study in 2016, they published the lowest amount of salt a day that keeps your blood pressure normal. They found in their study of 500,000 people in 49 countries. The lowest daily intake that led to the most perfect blood pressure readings is 6,000 milligrams.
Okay. Wow.
It's 6,000 to 9,000. They even said as you get to 9,000 milligrams, the results of blood pressure were better. Okay, now this is important. I know that sounds crazy, but what amount of salt is in every saline fluid bag in a hospital?
Can we go back to this? Can you paint the picture again of the IV drip? Because we've got these two pictures now of the medical system where actually every day this is being used. Every patient, as you say, no matter what their situation or how critical their support is needed, whatever it is, they're put on an IV drip.
Yeah, my mother-in-law is 93 years old. A year ago, she goes into the hospital after falling in the assisted living quarters. She goes in the hospital at midnight, taken there by ambulance. Young lady, her blood pressure was 280 over 180.
Oh, my goodness.
And this happened within 24 hours of her flu shot last year. Okay, within 24 hours, she falls, busts her head, has high blood pressure, and is in the hospital right after the flu shot was given to her last year. Even though we told her not to, everybody in that assisted living place was doing it. Peer pressure even exists in the 90-year-old community. She's in the hospital now at midnight. I get there. There's no MD even doing the rounds. There's somewhere else in the hospital. There's no one coming. It's an hour before anybody gets in this little area that we're waiting in the emergency room. When they take her by ambulance, put her right into this little room in the ER center, the very first thing they do, a nurse walks in, hooks up an IV saline bag, and then injects it into her veins and immediately does what's called a push. So they take the clamp off the tube that restricts how fast the water goes into her body. Okay, I need to set the stage for you. She has blood pressure at 280 over 180. So severe, the ambulance has been called to take her to an emergency room, and the first thing they do before a doctor even enters the room to evaluate her, they send a nurse in there. The instruction is Nurse the station, get in there and give her an IV bag push. Now, the push means do it now and do it quick. All right, so they go in there, take the clamp off that restricts how fast the salt water goes into her body. They took that off. Okay, listen to me, people. The FDA says no more than 2,300 milligrams a day of salt. If you eat more than that, you're going to develop high blood pressure. Risk factors for strokes and heart attacks go up. Okay? If you do more than 2,300 milligrams. The American Heart Association says, no, FDA, it's actually less than that. No one should eat more than 1,100 milligrams of salt a day. Listen, the bag they pushed in 20 minutes into my mother-in-law's veins, who had 280 over 180 blood pressure, stroke level blood pressure. Every bag of salt water, called saline or IV fluids, has 9,000 milligrams of salt in it. That is
Mind
that's 9 times what the American Heart Association says.